So if you have a client who comes to you for the first prenatal visit, what are you going to do as your nursing assessment? Nursing assessment in the first prenatal visit. What are you going to do? So when a client comes to you, nursing assessment, number one, you want to assess the complete health history of the client, right? And then you want to do a complete physical exam. Now, the health history of the client, you want to assess the weight of the client. You want to assess the nutritional history of the client as well. You want to assess the exercise pattern of the client because you may give advice on all these things. Then you also want to check the medication history of the client. The medication history of the client as well must be checked. And in the medication history, you want to assess if the client has been on any over-the-counter medications, any prescription medications, right? Has the patient been taking any teratogens? When I say teratogens, I mean medications that can cause deformity of babies. For example, in the past, there was this medication called thalidomide that people were being given for, I think, nausea in pregnancy. And when babies were being born, they saw that some babies would not have a limb, some will not have an ear, some will not have like multiple deformities. So you want to find out if the patient has any is taking any teratogenic medication. Because if the patient is taking any teratogenic medication, they have to stop it. And then you also want to check, is the patient taking any illicit drugs, cocaine, fentanyl, heroin, any drug which can affect the baby. You want to be very careful about it. So know that these are the things you want to find out on history when you're assessing a client who is coming for the first prenatal visit. Other things, you also want to check the allergy history. So it's just like, the principles of how to take a general history, the surgical history of the client as well, the past and present medical conditions, okay, past surgeries. And, you want to check surgeries which can affect pregnancy. For example, surgeries on the uterus, like a patient who has uterine fibroid, and then, surgery has been done. You want to find out, okay? And you also want to find out about viral infections like HIV virus, like hepatitis B, like hepatitis C, all those viruses, cytomegalovirus, all those viruses. In fact, there's a whole presentation we'll have to do on the screening test you do for an early pregnancy. And then that one we can dive deep. But today, I just want to touch on them. HIV, hepatitis B, hepatitis C, the touch. We have something we call the touch infections. Okay. And then chronic medical conditions like diabetes, high blood pressure, bleeding disorders, cardiovascular disorders, kidney disorders, thyroid disorders. Why? Because pregnancy can make these disorders bad or worse. Diabetes itself is not very good. And if somebody is pregnant with diabetes, it can affect the baby's size. It can affect even the mother who is carrying the baby itself. Hypertension. If there's hypertension in pregnancy, later on we are going to go into hypertension in pregnancy and then deal with all the components. You realize that it can cause headaches, it can cause visual blurring, it can cause enlargement and stretching of the liver, right? It can even cause kidney failure. It can cause what we call HELP syndrome, but I don't want to bore you with all those ones. And if somebody has bleeding disorder plus pregnancy, not good friends. Because don't forget that at the end of pregnancy, there must be delivery. When there's delivery, there will be bleeding. And if the patient has bleeding disorder, my goodness, you better start preparing for that. Because if it is not catered for, the patient can bleed to death, right? And then cardiovascular disease. If the patient has any cardiovascular disease and the patient is in labor and stressing to deliver, they can even get a cardiovascular compromise and they can be in trouble. Kidney disease and thyroid disease. When patients are pregnant, their thyroid demands go up. So you want to find out all these things so that if you need to adjust medications, you do so. Please, are we all on the same page? Yeah. And then you want a gynecological history. When was the last pap test? Has the patient had any previous infections? For example, any STI, because STIs can predispose to abnormal fallopian tubes, which can predispose you to ectopic pregnancy, right? Age at menarche. Menarche is the first time the patient had her menses. What has been the patient's menstrual history? Is it regular? Is it irregular? Is it heavy? How many pads does the patient use? Does the patient bleed in between menses? And contraceptive history. For example, you can still get people who are wearing an IUD who may be pregnant, right? So you want to know all these things. Is the pregnancy even wanted? Because maybe the patient was using a particular contraceptive method which failed, right? And then obstetric history. You also want to find out how many pregnancies has the patient had? Were there any complications in the past pregnancy? Because that can also help you as you are planning for this new pregnancy.